On this Thursday night, the deadline to crack down on the world's longest border. New details on how soon it could happen.
There is nothing we won't do to keep you safe.
Plus, the struggle to enforce social distancing. Italy's morbid milestone, the staggering number of deaths from the crisis overwhelming that country, and pumping out necessities.
We're supplying some of the old folks' homes.
The distilleries lending a helping hand during the pandemic.
Global National with Donna Friesen. Reporting tonight, Robin Gill.
Good evening and thank you for joining us. We are once again focusing our program tonight on the COVID-19 pandemic. From the latest measures to tackle the virus to the efforts to get stranded Canadians home. We have full coverage of this fast-changing situation, but we begin tonight with a grim update from overseas. Italy, which for weeks has been overrun by cases, has now officially surpassed China's death toll. Italian officials reported 427 more deaths today. That sent the overall death toll surging past 3,400. And that's what Canada is trying to prevent. But health experts and the government warn the worst is yet to come. They're urging people to stay home. Here's what the Prime Minister said today when asked, how long will this last?
We've heard anything from weeks to months. We know this is a difficult and extraordinary time in which Canadians are taking difficult and extraordinary measures, and we will continue to do that until Canadians are safe.
3 more deaths were reported today in Canada. Alberta recorded its first. A man in his 60s. A man in his 50s died in Ontario. And there was another death in BC, connected to a North Vancouver seniors care home. That brings the total number of deaths to 12. As for total infections, more than 860 people have tested positive. Of those, at least 10 people have recovered. All 10 provinces have detected the virus. In 6 provinces, 20 or fewer people have tested positive. Most of Canada's cases are in BC, Ontario, Alberta, and Quebec. Public health officials are pounding home the message, stay home.
Our collective resolve to overcome COVID-19 must be solid and unbendable. We don't just need to flatten the curve, we need to plank it. And we need everyone, from government to communities, families and individuals to work together.
The federal government revealed plans yesterday to shut down the U.S.-Canada border to non-essential travel to help slow the spread of the virus. There are new details tonight on when that might happen. Here's Mike Armstrong.
Even a full day after announcing the closure of the Canada-U.S. border, negotiations continue. The Prime Minister says the plan is to close it effective Saturday morning, but the deal's still not done.
We are continuing to work on the fine-tuning of the agreement between Canada and the United States. I think it's almost there.
The two governments are trying to delicately balance the importance of cutting off non-essential travel, while at the same time ensuring trucks and workers who do have to cross can and easily. Critical food and medicine and supplies have to keep moving. The border isn't closed yet, but the government is appealing to Canadians to treat it as though it is.
Don't wait for Saturday to do this.
Now, the border closure is part of the entire social isolation effort to slow transmission and flatten the curve. To this point, 83% of COVID-19 cases in Canada have been traced to travel. But those positive tests were from transmission that happened a week and 2 weeks ago. How well social isolation is working won't be known for a couple of weeks from now.
So what I would like to see, and I'll be watching very closely, is in the next 2 weeks or so, what actually happens to that curve.
One area where the government is struggling is getting Canadians home. With airlines parking more and more of their fleets, options for travelers abroad are drying up. And it's getting harder and harder to land planes in countries that are also dealing with this crisis.
It's a very complex situation. We understand how frightening it is for people.
Now, the Prime Minister was asked about Canadians who traveled recently and are stuck, perhaps due to their own carelessness. Should taxpayers have to foot the bill to bring them back? Well, Justin Trudeau says right now the government's not judging people, it's worrying about helping people. Robin?
Mike Armstrong in Ottawa. Thanks, Mike. With the virus spreading, restrictions in this country are growing by the day. Many communities have banned large gatherings and ordered the shutdown of bars and restaurants. At least one province has unveiled strict penalties for anyone who fails to comply. David Akin has more on the aggressive push to flatten the curve.
Airlines are already letting only Canadian citizens or permanent residents board planes bound for Canada. But airlines are also being told that no one, not even a Canadian citizen, gets on a plane bound for Canada if that traveler is exhibiting any COVID-19 symptoms. Those that show up at the gate with a dry cough, fever, or other flu-like symptoms will be required to do one of two things: complete a 14-day isolation and return to the airport symptom-free, or get a medical certificate certifying that the symptoms are not related to COVID-19. This could mean that some Canadians could be delayed returning home.
We're focused on trying to get our air operators to facilitate more flights to get Canadians home. We recognize that this is a very difficult and exceptional situation.
As for interprovincial travel, Prime Minister Justin Trudeau is not prepared to set restrictions on that now, while Ontario's Premier said he was reluctant to have police or other authorities enforce social distancing guidelines.
People are cooperating, and we can't do this by really, going out there and enforcing it. We need their cooperation.
Provincial and local public health officials already have significant legal powers, including the powers to levy fines or even seek jail times in order to enforce quarantines. But those powers vary and are generally seen as a last resort.
If someone's particularly high risk to someone else's health, that such approaches can be exercised. But one is not aiming for that to be the key response.
Still, the federal cabinet met Thursday afternoon, and as the Prime Minister said before joining that meeting, the cabinet is still considering what, if any, new emergency powers it ought to have and when they ought to be applied. Robin.
David Akin in Ottawa. Irving has suspended all industrial operations at its shipyard in Halifax for a 3-week period as a result of the COVID-19 pandemic. The shutdown at Halifax Shipyard, Marine Fabricators and Woodside Industries went into effect this afternoon. About 1,100 unionized workers have been laid off. The shipyard has federal contracts for 6 Arctic and offshore patrol vessels and for 15 Canadian surface combatant ships. South of the border, the number of confirmed COVID-19 cases has surged past 10,000. That number is expected to grow even more in the coming days. The governor of California says projections show 56% of his state could get the virus. That's 25 million people in California alone. Across the U.S., health officials are sounding the alarm about a severe shortage of essential supplies. But as Jackson Proskow reports, the White House insists it's managing the response.
As U.S. hospitals begin to buckle under the weight of the new coronavirus, doctors and nurses issued a grim plea for more supplies to treat patients and to protect themselves.
In ICU, we see the people coding. We see the people on the ventilator. There's lots of unanswered questions.
With a dire shortage of protective masks and ventilators, the U.S. Centers for Disease Control relaxed its guidelines, suggesting medical workers with exposure to COVID-19 but with no symptoms can keep working, advising they wear scarves and bandanas if they run out of masks. But in Washington, the president was unwilling to entertain any suggestion of a failure to prepare.
We were very prepared. The only thing we weren't prepared for was the media. The media has not treated it fairly.
After weeks of delay, the U.S. is now relaxing laws to allow construction masks to be used by medical workers, asking for existing antiviral drugs used to treat malaria to be tested on coronavirus patients.
To determine if an experimental or an off-the-shelf drug that's used for something else can safely and effectively treat patients.
As testing improves, the number of confirmed cases has skyrocketed. There are now more than 3,600 in New York City alone.
It feels like I have a belt around my lungs, so I can't take too deep a breath.
2 members of Congress are confirmed to have the virus. Several more are in isolation as lawmakers debate a $1 trillion economic rescue package. The trajectory of infection suggests the U.S. is on the same grim path as Italy, facing an unprecedented crisis. Jackson Proskow, Global News, Washington.
The number of cases in Spain jumped 25% overnight. In France, 18%. Now, the Cannes Film Festival, arguably the world's most prestigious film event, is being postponed. But there's new alarm in Italy tonight. As Redmond Shannon reports, the death toll there has now surpassed China.
The Italian army on the streets of Bergamo, not to protect the living, but to transport the dead. The northern city is overwhelmed with bodies, so many of the victims are being moved for burial elsewhere.
Nurses and physicians are working round the clock, countless hours to fight this incredible situation.
Italy has now overtaken China in total coronavirus deaths, with a staggeringly high fatality rate. The nationwide lockdown is set to be extended beyond next Wednesday, a crisis worsened by many hospital staff testing positive too.
I contagi sono tantissimi, I morti.
We're not even counting the dead anymore, says this nurse. Our stress is through the roof.
Here in the UK, the government is being criticised for being too slow in encouraging and demanding social distancing. But on Friday, schools closed indefinitely, and bit by bit, London is grinding to a halt.
Some subway stations are closed, but British Prime Minister Boris Johnson said there is no prospect of a full lockdown in the capital.
We can turn the tide within the next 12 weeks, and I'm absolutely confident that we can send a coronavirus packing in this country, but only if we take the steps, we all take the steps that we have outlined.
Those steps include staying away from bars and restaurants, even though they're still allowed to stay open. Always an optimist, Johnson says there is hope.
We're in negotiations today to buy a so-called antibody test, as simple as a pregnancy test, that can tell whether you have had the disease.
The idea to allow people out of isolation as the crisis subsides. But the focus for now is managing a disaster that is yet to peak. Redmond Shannon, Global News, London.
The Queen and Prince Philip have arrived at Windsor Castle, where they're expected to remain during this pandemic. The 93-year-old monarch was seen leaving Buckingham Palace today. In a statement, she urged Britons, now more than at any time in our recent past, we all have a vitally important part to play as individuals. You can be assured that my family and I stand ready to play our part. Prince Albert of Monaco is also urging people to take proper precautions after he tested positive. The palace says the royal status is not worrying at all. The 62-year-old is believed to be the first head of state to publicly confirm having contracted the virus. Frustration and optimism on the front lines. Coming up, how healthcare workers feel and their message to the public. Anxiety, frustration, and a sense of duty. Those are some of the emotions being felt by healthcare workers on the front lines during the biggest health crisis of our time. Heather Yerkes-West shows us how some are coping and their concerns looking forward.
Inside this Toronto hospital, healthcare workers are getting ready to face a challenge unlike anything they've ever seen.
The situation that we're seeing is unprecedented. I think for frontline physicians, there is an element of frustration in that we feel we know what needs to be done today to protect the public from the resource limitations that we foresee.
Dr. Michael Warner says government messages about social distancing haven't been strong or consistent enough. He feels more needs to be done.
Social distancing cannot be done in half measures. It has to be done by everybody. That means that, from my perspective, it's not okay to congregate in groups of less than 50.
In Alberta, Dr. Wendy Sliegel is more optimistic.
I think that we've seen over the last couple of days very aggressive measures taken by our government, and I feel quite reassured that most non-essential services have essentially been shut down.
This ICU physician believes the next 3 to 6 months will be incredibly challenging, but she says the public can help healthcare workers by staying calm.
I think a lot of the fears, again, I think people can be reassured by knowing that we are prepared to handle this pandemic, and panic will only impede our success in managing this.
Much of the health system's success will depend on what all Canadians do now. It's why some frontline workers have been taking their appeals to social media. This post by a nurse from Ontario has been shared more than 100,000 times. This is a matter of life and death, Ashley McIntosh Barton writes. Stop being selfish and think of everyone else who is already fighting for their lives.
This is what we trained for. This is why we chose this job.
Because whatever happens next, frontline workers are committed to help. They just need to know they're not in this fight alone. Heather Yerkes-West, Global News, Calgary.
Can COVID-19 be spread through surfaces? Still ahead, experts answer your questions. Here's a heartwarming note that should put a smile on your face. A Canadian kid got a rare response from the Prime Minister after writing him a letter about COVID-19. The 8-year-old said, "Please do your best. I don't want it to get to any of my grandparents." The Prime Minister responded with, "We're working super hard to slow down the spread and keep you, your grandparents, and all Canadians safe." Many of you also have concerns about the virus and have been reaching out to us. Our Jeff Semple went to the experts to get some answers. So Jeff, what's the latest on how long it can live on surfaces?
Well, Robin, health experts say that COVID-19 isn't airborne, but is instead spread through droplets that are created when someone coughs or sneezes and are often then spread on different surfaces. And that's prompting a lot of viewers to ask this.
Hi, my name is Lil Ronalds and I'm calling from Vancouver, British Columbia. And my question is, how long does the COVID-19 virus last on different types of surfaces?
And on different surfaces, it can last up to a couple of days.
A new report found that the virus can survive on cardboard for up to 24 hours and on a plastic surface for 2 to 3 days, meaning someone could cough on this bench and a couple of days later someone comes by, touches the bench, rubs their eye, and gets infected. The virus is less likely to survive on porous materials, such as clothing or pet fur.
Depends on the surface, the temperature, and the humidity.
Hi, my name is Sam. Me and my wife live in Vancouver, BC, and we are almost 20 weeks pregnant. And I was wondering if pregnant women are in fact more susceptible.
Fortunately, the little information we do have would suggest that pregnant women are not at an increased risk of getting this. And there's even doubt as to whether the virus can pass through the placenta and infect the fetus.
On the streets of Toronto these days, it's not uncommon to see people walking around wearing one of these, a surgical mask, or even the professional grade N95 respirator.
My name is Barbara. I live in Keswick, Ontario. I was wondering, would masks help in this case?
Experts say there's no evidence to support wearing masks, and users are often more likely to touch their face.
So the only reason to wear a mask is if you are sick.
He says the best advice is to avoid gatherings, even in small numbers. But one viewer wrote to say that it seems there are a number of people choosing to ignore this self-isolation mandate. The St. Patrick's Day celebrations at Queen's University went ahead despite warnings from officials.
So I have a compromised immune system, but I'm still only 21, but I'm not even worried.
If you get this disease and you have the sniffles and a fever, it doesn't mean that the person you pass it to, who could be your parent or someone else you care about, won't have completely different symptoms in them. They could die because you passed it to them.
If you do the math, the result is grisly. Conservative estimates suggest that around a third of Canadians will catch COVID-19 and that 1% of those will die, meaning more than 100,000 Canadians are expected to be killed by the coronavirus this year. Robin?
Thanks for that information, Jeff. One question that remains unanswered, whether or not the Tokyo Olympics will be held this summer. The International Olympic Committee has said the Games could still begin on July 24th, despite the pandemic. But Canadian Hayley Wickenheiser believes that's the wrong move.
Nobody knows what's happening with this virus today, let alone tomorrow, let alone 4 months from now. And I just feel that the insistence that the Games are going to happen in July is doing a disservice.
The 6-time Olympian posted this statement on Twitter, raising concerns for athletes and the general public. Wickenheiser is studying to become a doctor and has witnessed the efforts to contain the virus. Up next, that's the spirit, the proof that innovation can help slow the spread of COVID-19. It's being called liquid gold. Stores are selling out of hand sanitizer as quickly as they can stock it. So some distilleries are seizing the opportunity to help by brewing up some of their own. Ross Lord reports on the Canadian companies pumping out a new product.
Dipping into the disinfectant market was a reluctant move for Nova Scotia's Ironworks distillery.
There's a lack of hand sanitizers on the shelves, which is not something
one would ever have expected, but it became apparent that we had a product that would do the job.
They're using the same main ingredient, alcohol, just increasing the concentration to 65%, the recommended level for killing germs.
We've had people breaking down the doors on Instagram and Facebook and other social media channels already because they want it and they can't find it anywhere.
No one knows how long this makeshift arrangement will last, but here at Ironworks, they hope it's short-term because that would mean the COVID crisis has eased. Like many Canadians, Lynn McKay has an emotional connection. A close family member has been stuck in the United States. Flight plans for coming home have been complicated. Ironworks is paying extra excise tax just to get hundreds of these bottles out the door.
We're supplying some of the old folks' homes if they ask for it, some of the shops in town who might have a need because they can't find anything.
Other distilleries are also helping out. This one in Halifax plans to give away its hand sanitizer as it sorts out kinks in the supply chain that make it tough to find additional bottles.
This was kind of like a curveball that sort of just started, within two days. We're just like, okay, we need to kind of jump on this and see what we can do.
Others are still sorting out distribution, confident demand for their new products is unlikely to fade anytime soon, doing their small part to counter a big problem. Ross Lord, Global News, Lunenburg, Nova Scotia.
And that is Global National for this Thursday. I'm Robin Gill. Tonight we leave you with a friendly reminder from BC.
If you want to go out, then you best think twice to stay home.
Stay Home is what these brothers call their self-isolation song. It's on YouTube where you can find the lyrics and sing along from home. Thank you for watching. Good night.
Think of your grannies, think of your friends. Do